Step inside the office where the stories unfold of sickness and healing of the young and the old. Dr. Jevon speaks.
Good day, viewers. Welcome to another episode of In Office. I am Dr. Jevon Samuels. In office today, I have a distinguished consultant of internal medicine, Dr. Lorenzo Gardi. Welcome to the show.
Right, thanks for having me.
Sure. Alright, so today we'll be discussing the Ebola virus, the recent outbreak that is occurring in Africa, as well as what it means to have a Worldcup right here in the North America, and what it means for healthcare worker, especially here in Jamaica, if we eventually develop a case. So, Dr. Gordon, what exactly is the Ebola virus?
Right, Ebola virus really is what we call an animal virus that is really found principally in wild animals. The one that is more common presently is Zaire type, which is found from the fruit bats.
Okay.
So the first outbreak recorded in 1976, simultaneously in two African states.
Okay.
And it occurred in Zambohu,
Yes.
which is a village close to the Ebola River.
Okay.
And that's why it got the name like that.
Okay.
That's how it got the name. So the virus really affects from wild animal to human.
Okay.
That's the first stage, of which there are 6 types.
Oh,
There are actually 6 types. They are recorded 4 types that affect human transmission. 3 more common, and maybe not simple way is the Zaire type, which is called Ebola virus.
Yes, which is the most
The most
type.
common type.
Yes.
You have the Sudan type, right? And you have the Bondi Gobo type.
Yeah, but that's
You
the
have
type.
also the other types that are the Thai forest type,
Yes.
and your Western and the Bombali type, but those are not so common.
Okay.
Principally, they have been outbreak, especially in 2014, and they are currently outbreak in an African state,
Yes.
in South Africa,
Yes.
right?
Since
Sub-Saharan Africa.
Yes,
And that is about, in the Guinea, Liberia,
the Democratic
Sierra
Republic
Leone.
of Congo.
And Congo.
Uganda.
Yes, Uganda and the Congo.
Alright, so recently the World Health Organization said it is a public health emergency of international concern, right? Because it's endemic there in Uganda. But what are some of the means in which this virus is spread? Why we should get alert? Because as far as I can remember, it's not spread by a droplet like COVID-19. So why would it become such a international concern already?
So, real concern is a couple of things that we must consider. Really, it's a virus that is not transmitted through air.
Yes.
It's really a contact virus. So,
Okay.
let us say how it started. It started by a human having contact with an infected animal in the wild, whether it's the blood, the urine, or the contaminated instrument, clothing, bedding, or any secretion of that animal, or the organ itself that they have eaten.
Okay.
Then it goes to the human. Then the human transmitted through direct contact. Or the direct contact can be the human secretion. That means it goes through broken skin or the mucous membrane to the eyes or the mouth or the nose or so. Right? From a contaminated somebody who have
Symptoms.
the virus and who must display the symptoms. So it is important to note that this is very, very dangerous. The fatality on the average is about 50%, but have been recorded up to 20 to 90%, and that's why people consider it to be serious. But the real truth of the matter, the good news is that once you get infected, you have up 2 days to 21 days more or less before symptoms. Although it has been shown and stated between 8 to 10 days, you start to have symptoms.
Yeah.
It is only when you have symptoms that you can transmit. But it is important that once you have the symptoms and you transmit, even when you are no longer symptomatic, the virus still remains inside of you. So until you do testing, to then show that you know how no longer have the virus within your bloodstream, then it can be considered to be totally eliminated. So for example, for men, it can last, who have been infected, it can last up to 7 days in their semen. So although they no longer have the symptoms, if they have sex with somebody up to 7 weeks after, they can transmit the virus. That is very important. It's important to note that the people who are high risk are healthcare workers and families who are treating their loved ones with the virus, because it's not the common person that you walk on the street and you spread it.
Yes.
It is the contact. So whether it's utensils or whether it's the food that you're sharing, that you must have physical contact with. And this is where people who are physically caring for people who are affected will have it. No, it may be dangerous in the Worldcup, because maybe if someone who has it and contact any surface or a secretion, whether they urine, a sputum, spit, or anything like that, get contaminated in the surface, and somebody now touch that through their mucous membrane or broken skin, that's when they get it. They are also part of what we have to the whole vigilance or surveillance of what we are to be observing, especially in Jamaica, at the airport, which the Ministry of Health has taken necessary steps, is that all persons who have visited are coming from those areas, be someone targeted to have what is called in somewhat isolation in a simple way. That means when you come in and you have any kind of contact coming from those places, or you have contact with somebody who has had the virus, you should do what is called self-isolation at home for between 2 to 21 days, in which you must monitor. Once you're having symptoms now, that's when it becomes serious. We then do the testing, and then we make sure that you would not transmit. So the people who are going to care for you, the family members and the doctors, and that's why they are high risk. The good thing about it is there are a couple of things that we must observe. And the observation will be the proper hygiene precaution. That means not touching the surface, making sure you discard the body fluid, making sure all the contaminated vessels or bed clothing of a person who is infected is properly disposed of. Of course, should we be concerned? We have not had any cases in Jamaica. Are there any treatment available? In fact, the treatment that we say that is available is what is called optimal control treatment, which is going to be supportive here, because persons who are affected once they become symptomatic, in a simple way, the symptomatic cases can be divided into two. What we call dry, I like that term, dry symptoms, in which the first set of symptoms that you may have would be your fever, your fatigue, your general weakness, your pain, and you have a rash
And it's
Right.
just flu-like symptoms.
It's,
and
it's
flu-like
kind of,
symptoms.
and this is why sometimes it can be
Right.
confused, like with your dengue, your malaria, and other types of problems.
Yeah.
So that's the first phase. The second phase is called the wet phase,
Okay.
in which now you start to vomit, you start to have diarrhea,
Okay.
and you now can start to have the presentation of bleeding, which will be kidney and your liver. And then the final advanced stage is when you're bleeding from all over,
Okay.
all over, both internally and outside, right? That is manifested, and that is when it becomes very serious. Mind you, not many cases evolve there, but once you evolve there, it's very difficult to treat. However, what we have in the world today, WHO has approved two treatments. You can say two treatments. One is a vaccine, but it must be stated that it's limited to only one of the strain,
Yes.
right? The Zaire strain, in which there are two vaccines that have been approved
Okay.
for persons or community. And it's important the treatment must be based upon community education and support, so that community will then be vaccinated.
Yeah.
The other treatment you have advanced treatment, which is called monoclonal antibody, which is a very advanced treatment, of which there are two that have been approved. Mind you, in studies now all over the world, we have vaccine being developed for the other strain and a monoclonal antibody treatment that, being studied and in the experimental stage right now in many labs all over the world. But the more important thing is to identify the individual, isolate, monitor. Once symptom occur, we now must have the facility where we can take that person and care for that person in a controlled environment in which we do not first contaminate the healthcare workers, infect them, or we do not allow families to come closer. Now, it's very important also to note that transmission is not only from person who are alive, but person who are dead.
Yeah, that's what I was gonna ask.
Dead, because also once person who have had the virus and they died, a proper burial ceremony and control must be then put in place, because the virus can be transmitted from the dead body. So the proper disposal at the time of death is very, very important. All of these must be education at the community level.
Yeah.
And therefore, this is why right across our world today, there's much information being given, but it's not as serious as some people say as the coronavirus that is going to be transmitted by droplets and respiratory thing. It's by contact. So if you then able to make sure you practice proper hygiene and having contact with notification of persons from areas that are endemic or having outbreak or so, and then you self or report that they are contacts. You go home and you isolate and you contact with our Ministry of Health, and they can then advise you, do your temperature. Once you start to fall outside of that 2 to 21 day period, then you are safe.
Alright, let me just intervene. So, in terms of previous epidemics with the Ebola virus, you know that normally United States play a big role in containing the virus in terms of sending aid, and they have the equipment and the expertise in the area. But no, in recent history, when the United States is taking not so much lead in the charge of healthcare because I think they exit World Health Organization, they cut a lot of aid. How different do you think that will make now they don't have the aid from the United States to help with their control of this outbreak?
Well, I mean, mind you, there are education and nothing beats education in a community. And we ought to understand community support.
Yes.
Majority of the control must be based on community support and education. We must understand we do not condemn individuals who may then have it, but we kind of support persons who have it, and then we give them the support up to a period that they may still be transmitted. All of this does not require any big financial support. Now, the labs that, for example, that have done the vaccine and all of the treatment, are labs that are elsewhere in the world.
Okay.
So I don't think that necessarily cutting off that kind of support. What it does in some international bodies that not supporting international research and treatment.
Yes.
It gives an opportunity sometimes for local labs or research to rise to the challenge.
Okay.
And one of the greatest things I think for human civilization is for them to find an answer. And it's also very important to know that indigenous community, cottage industry, that even based upon simple research can rise to the forefront.
Okay.
And we must understand also persons may have the opportunity to look at natural treatment, natural remedy and support. So even when you do not get this big international support, which of course I'm not saying is not needed,
Yes.
community may look inside and develop strategies to counteract a disease process. We should never forget our own spirit of community and support within before we look outside. That's my answer to all of that.
Alright, another thing is that normally with the Ebola virus, because it is it's confusing, they normally mix it up with other illnesses such as dengue or malaria, etc. It sometimes can be suspected late when it already spread. So I'm saying in terms of, you said Jamaica, I've never got a case in Jamaica, confirmed case, but in the likelihood in our setting, if someone should present and start to have an outbreak in Jamaica, what are some of the steps that we as a nation will have to do in order to prevent it? Because I remember that we're also a third world resource limited country, and you know that Jamaicans tend to run along with misinformation. Just for example, like the COVID time, persons refuse to social distance, refuse to wear face masks, etc. And hand hygiene practices sometimes may be lacking in Jamaica to an extent. And for example, like sometimes you like persons urinating, spitting on the street, it's common in Jamaica. What do you think Jamaica would fear if that coming and the virus should come here in Jamaica?
Well, the only good thing about it is the port of entrance is very important because it is not endemic. We don't have the reservoir, the bats or wildlife here in Jamaica.
Okay.
So it must be the port of entrance. So if we and the ministry have set up at the port to take the interview and track persons, we have a very good system in Jamaica where we can track persons who may have had contact with anyone who may be infected.
Yes.
And the good thing about it is that period of symptoms. And so education is important at the community level.
Okay.
And that's what is going to be the strongest point of control for us Jamaican. And I believe that in Jamaica we have a very good support system of education at all levels in the community. Our healthcare system in terms of the public health clinics, and so forth. It's very good at that in terms of its education mandate and information. So our vigilance at the airport or at the entrance, the cruise shipping or other entrance is where we must be vigilant. And if we suspect a case, we must isolate immediately. We educate all the persons who have had contact, and the ministry is mobilized to take action. And once we do that, we'll be able to continue.
Alright, so since we have covered the main aspects of Ebola virus, I just wanted to sum up today's session and then we can break.
Well, mind you, the fear of Ebola, we have had outbreaks before. We had a major outbreak in 1976. We have had many outbreaks, a huge outbreak was 2014, but it has been around, it hasn't gone, and I think, let us say that Jamaica has been vigilant. If you travel through the ports, we have individuals there who take information. We have the nurses, healthcare nurses that get information and speak to individuals who enter the port. That we can continue to do. If we should have such a case that is isolated, we have the system in Jamaica to inform and take the necessary step. Maybe somewhat we have had that dry run of COVID virus and what has happened. So many persons now are somewhat educated or understand what could happen. And I think at the level of the community, they are more motivated to jump on board, to isolate, to take the necessary action. So I think we are somewhat prepared because we have had, plus at last, just 7 to 8 years ago, all of what has happened. So it's still a new experience. I think what has happened, we must not drop our guards. We must look at our ports of entrance. Once we isolate, should happen, we must then inform and we take the necessary hygienic action, and like nobody will get this virus by somebody passing you on the road. It must be a personal contact, whether on the surface or body fluid. So this is not, as you could say, in terms of its spread, like COVID virus. So you have to be vigilant out there to make sure that you take hygiene seriously, that the body fluid is disposed of properly, that contact of infected person, you isolate, you destroy those contaminant things. And when I say contaminant, whether the clothing, the bedding, the utensils, the body fluid, all of those must be controlled. And I think when you have that, we are well educated. If this should happen, I think that we will be prepared to control it.
Alright, so Dr. Gordon, thank you very much for taking time out of the busy schedule to come and give this interesting speech on Ebola virus. I hope it should be beneficial to the general public and should be careful when we are and be vigilant at the state because there's a current outbreak and God forbid that we don't know if it can spread further for us. Alright, so thank you very much once more, alright?
Alright, my pleasure.
Step inside the office where the stories unfold of sickness and healing of the young and the old. Dr. Jevon speaks with wisdom and care.
In office with Dr. Jevon Samuels.